for this handsome guy. So we're gonna narrow the dorsum. Proportion of the intermalar distance with the intergonial distance is very critical. So since we're not augmenting this now, which we could if we desired later on, we're gonna get this part of the intergonial distance reduced to give much better facial proportions. So we're planning to first do a nasal intubation, work on the lower third of the face, and then give an oral intubation and work on the nose. In some patients on whom we do a similar face makeover, we can also do an intubation from the transmalar head region. And you see his current lower border is on this line. This is this line. You see, I'm putting my fingers and you can see the way the mandible is. We're going to give him this jawline now. That's the plan. I'm also going to take it inside and I'm going to do a little work on the chin because he has an asymmetry. I'm not going to do much. He doesn't want anything else. He just wants that. And a similar plan on this side where what the current line is. You can see that. And the proposed change or the plan. So we've just finished with the lower jaw work for this patient. We've done genoplasty, osteoplasty, genoplasty, angle osteotomy, osteoplasty, jaw sculpting, right? Now what we're going to do is nose. One of the ways we do it is to put a transmalar or a intubation that's going to get the whole face open for us. But for this guy, we chose to do the nasal intubation for the lower third facial work. And now that we're done with that, our anesthesiologist and his team is going to remove this tube from the nose and it's going to come from the mouth, right tube. This is for his nose. His main issue is a blocked nose. So we're doing this for functional reasons. And while we're doing it for functional reasons, we're also going to take care of his aesthetics a bit. So this is going to be a closed rhinoplasty. Plan is to do the osteotomy, alar base work and septoplasty. And we just finished this septoplasty. So we had a deviated septum. Show me the septal cartilage that was removed. So I've removed the septal cartilage. This was a bent aspect inferiorly. So that was removed and I fixed the septum on the midline. Now I need to put some sutures to make sure the septum is bang in the midline. 2-0 Michael. That's the patient before. We've done a closed rhinoplasty, actually a septorhinoplasty because we've done more work on the septum. I'm going to show you the sutures all the way back. The septum was totally deviated, so we've corrected the deviation. I've done an excision of the septal cartilage, tip plasty from inside, nasal osteotomy, both lateral and medial, and alar base work. And that's how he was. So we've given him a much more defined tip because of the tip work and because of the septal work. We've got the alar flaring narrowed, as you can see from what it was. Yeah, just show me the, I'm going to show you the alar base things that we've done. So that's the septal cartilage. Well, we couldn't use it because he didn't need it. Did the tip without that. And then these are the two alar base excised specimen. Not exactly specimen because we're going to throw this off. That's pretty much similar. Even though I placed my dead space stitches, it's very essential to pack the nose, especially when major septal work has been done. So this not only prevents the septal hematoma, but also ensures that there's no you can see that. So this was him before we did asymmetric correction, that was with the chin. I also did some jaw sculpting and angle osteoplasty, like a V-line surgery. He also had issues with his nose, especially with breathing. So we corrected that as well. Yeah, looks straight now. So this is him now. You can look a little bit towards me. Yeah. So you can see this is the area we've done the surgery. This is 4 weeks now, right? So this is 4 weeks after we've done the surgery. And in this also you can see here a very broad, squarish face. So we've given much more definition to the angle, and we've taken the square face in. So we've now made it more angular. His malar bones and the interconial distance are almost the same, but now you can see it's nicely going in. And this is only 4 weeks, right? 5 weeks? 4 to 5 weeks, okay. So what do you think of the result? It's good? You're happy with the result? And are you having any problems with eating or anything? No problems with eating. Okay, but you said once in a while you have some nasal blocks. So we'll give you some drops for that which you can take. And are you almost back to normal routine or normal routine is fine? Any discomfort when you're chewing or anything because we didn't work on the angle? Slight? Yeah. Can you bite hard and chew now? Okay, no, since it's still just beginning to function. Okay, I can't see them. So that happens because when we're doing the square face, when we are doing the work on the angle, the muscles take a while to get inserted or attached back on the bone, and once that happens, then also in this view you can very clearly see the chin has moved towards the left side. It was like a pointy, and you can see here, right? This width and this width, you see very clearly it's the same. Now all of that swelling we've taken off, and we've given you a much more nicer proportions. Actually, I wanted to do little alar base also, but we didn't want much work on alar base, so we just reduced the narrow and made it just a little bit on the tip. Okay.